going to focus right now. We're going off the topic of chest tubes. We're going to focus on best questions, because remember, best questions are always fundamental. They're always testing a fundamental principle. The home care nurse visits an older adult client with a recent history of stroke, resulting in a neurogenic bladder. The client is incontinent and has developed repeated urinary tract infections. Which action by the nurse is best? So what is best to do? Now, this is a little bit different than a lot of best questions. It's still what's best to do, but there's a lot of information in the question. So I can't really just cross anything off because I'm not quite sure what they're really asking me here. What's best to do for what? I mean, they've got all these problems. So what's best to do for what? So let's first of all, when you get a question like this, where there's just a ton of information in the question, and then they say, what's best? You go, well, for what? Then what I want you to do is connect each answer with a problem in the question. That's what I want you to do first. And then you might be able to rule a couple things out. Okay, so let's read each answer and say, well, which one is this going to help with? Out of all the problems. And remember, you only know what they tell you. So if it's an answer that doesn't address any of the problems in the question, then we're not even going to consider it, because I am not going to consider answers that address a problem that has not even been identified. I'll say it again. I am not going to pick an answer that addresses a problem that has not even been identified. And people do this a lot, y'all. So first of all, let's look at the answers. Teach the client exercises to strengthen the pelvic floor. So basically Kegel exercises, right? Teach the client exercises to strengthen the pelvic floor. So what is that going to help with? Well, she had a stroke, so it doesn't do anything to help with a stroke. She has a neurogenic bladder. Maybe it could help with, but a neurogenic bladder is a spasming bladder. I mean, it could maybe help a little bit. They're incontinent, has developed recent urinary or repeated urinary tract infections. Well, I don't love it as an answer, but it could help, maybe help with the neurogenic bladder. The best way to deal with the neurogenic bladder is actually to do relaxation strategies when you feel like you've got to go, kind of focus on relaxation and kind of breathing through it. That's really a better way to deal with neurogenic bladder, but I'm going to leave it on there. Perform intermittent catheterizations for residual urine. All right, intermittent catheterizations for residual urine. What is that going to deal with? Is that going to deal? It's not going to do anything for the stroke. The stroke is the stroke. She's not going to get better from the stroke. It's not going to help with the neurogenic bladder, but they are incontinent and have developed UTIs. So that could really help with that. It could help with that if we can check to see if they've got residual urine. If she's not emptying her bladder, that could be one of the reasons she's getting those UTIs. So I'm going to leave that on there. Assess the client's fluid intake over the last 48 hours. Okay, assess their intake over the last 48 hours. That's not going to do anything to help with the stroke. It's not going to do anything to help with the neurogenic bladder. It's not going to help with the incontinence. I mean, is it going to help with the UTI? I mean, just assessing her fluid intake, that's not going to treat the UTI. It's not going to do anything to treat it. I'm going to cross that one off because that just, to me, I don't see how that's going to help any of the problems that are identified in the question. I just don't see how that's going to help. Teach the client about a dietary intake high in fiber. That's a good thing to do, but it's not going to do anything for the stroke. It's not going to do anything for the neurogenic bladder. Certainly not going to do anything for the incontinence or the repeated urinary tract infection. So I'm going to cross that off because that doesn't even address any of the problems. So yay, I got it down to 2. I like it when I get it down to 2. That's always nice. So I'm going to do one, but never do the other. I'm going to do one, but never do the other. So I could teach the client exercises to strengthen the pelvic floor, which might help with neurogenic bladder, maybe, but I'm never going to perform an intermittent cath for residual urine, which could be the reason why she's having repeated urinary tract infections. Or I'm going to perform an intermittent cath for residual urine, which could be why she's having repeated UTIs, but I'm never going to teach her to exercises to strengthen the pelvic floor. Well, it seems to me like the repeated UTIs is the acute problem, and it seems like I need to know if she's having residual urine because that could be why she's having UTIs. So I'm going to have to pick this one. This is going to be my best answer. And do you remember I told you that these best questions are always testing a fundamental principle. It's not always easy to figure out what fundamental principle they're testing, but they always are testing a fundamental principle because there's no way an answer can be best if it's not fundamental and something you have to do. Now, if I had said to you yesterday, what's the best way to prevent UTI? You might have said, well, clean from front to back. Okay, fine, clean from front to back. Anything else? You go empty the bladder. Don't wait too long to go to the bathroom, right? We're all taught that as nurses. Don't go 12 hours without urinating because you're just going to get a UTI. How many of you have been taught that? Right? We all were taught that. Like one of the first things we were taught. So emptying the bladder as a way of preventing UTI is a pretty fundamental principle, isn't it? And if they had just said, hey, what's one of the best ways to prevent UTI? And they said emptying the bladder, we all would have gone, yeah, I know that. Look how hard they're making this fundamental principle question. This is a fundamental principle. But if there's somebody who knows, if there's any organization that knows how to write a difficult question to test a fundamental principle, it's the National Council of State Boards of Nursing. This is why you have to know your fundamentals and you have to have good testing strategies. You have to know how to answer test questions. It's not always about knowledge. Sometimes it is, but it's not always. If you are someone who has failed NCLEX multiple times, particularly if you failed multiple times at 145, and I know you're out there, don't feel bad. I've worked with lots of people who failed multiple times at 145. And do you know what I always tell them? You have to study your fundamentals. You have to get that fundamentals textbook. We recommend it. There's a YouTube channel, that kind of homepage where I'm interviewing Mark Klimick. We talk about this book in that video, so you can watch that video and find out what book we're talking about. That you have to get that book. You can rent it for $40. I don't get any kickback on this, y'all. It's totally, we don't have any financial relationships with anybody. So I'm not making any money off of this. That's my favorite book. That's Mark's favorite book, The Fundamentals, Potter and Perry Fundamentals. You need to go through every single question at the end of each chapter. You don't have to read the book. That's not what I'm saying. You don't have to read the book. You have to go through all the questions. There's about 10 questions, sometimes more, at the end of every chapter. That is a comprehensive review of the fundamentals. If you have failed NCLEX multiple times at 145, that is probably your hang up. That and prioritization questions. You have got to practice strategies for correct prioritization depending on the type of question you're being asked. Let's do another best question. This one I put the same answer twice. So you're going to only have to go through between 3 answers. Which action by the infection control nurse in an acute care hospital will be most effective, that means best, in reducing the incidence of healthcare associated infections? Which action by the infection control nurse in an acute care hospital will be most effective in reducing the incidence of healthcare associated infections? Okay. Well, this one is not nearly as detailed as the last one, so I can't really, I can go and see if any of them really would not help at all, but I'm not sure. So let's look at it. Require nursing staff to don gowns to change wound dressings for all clients. Well, that could help reduce incidence of healthcare associated infections. Ensure that dispensers for alcohol-based hand rubs are available in all client care areas. That could definitely reduce healthcare associated infections. Screen all newly admitted clients for colonization or infection with MRSA. That could help. So they all could help. So there's none here that I go, well, absolutely not. I'm not going to pick that. Okay, so when you have more than 2, you're going to have to take 2 at a time. 2 at a time. And then you cross one off and then you don't consider it again. Okay, so let's do 2 at a time. I will require nursing staff to don gowns to change wound dressings for all clients. Doesn't matter what, if they're infected or what the infection is. You're gonna have to gown for every single wound dressing change they do. But I'm never going to make sure that dispensers have alcohol-based hand rubs. Alcohol-based hand rubs is hand sanitizer. So I'm going to change that word because I don't like the word alcohol-based hand rubs. I'm not going to ensure that dispensers have hand sanitizer in all client care areas. Ooh. I'm not going to have hand sanitizer in all client care. They're never going to have hand sanitizer in client care areas. Yikes. Or I'm going to make sure that all client care areas have hand sanitizer, but I'm never going to require that nursing staff wear gowns for all dressing changes. They don't really need to wear gowns for all dressing changes. But gosh, we got to have hand sanitizer, don't we? Don't we have to have hand sanitizer in all client care areas? Yikes. All right, I'm going to cross this one off. All right, I'm going to make sure that we have hand sanitizer in all client care areas. But I am never not going to screen newly admitted clients, all newly admitted clients for MRSA. I'm going to screen all newly admitted clients for MRSA, but I am not going to have hand sanitizer in all client care areas. Ooh. Don't I have to have hand sanitizer in all client care areas? Don't we have to? Yeah, I think we have to. Okay, so I'm going to have to do this one. This one I have to do. This is a must. And what is the fundamental principle of the testing here? Well, they're retesting. What's the most effective way to reduce healthcare associated infections? Wash your hands, y'all. That's pretty fundamental. Does it get any more basic than that? If I said, what is the best way to reduce healthcare associated infections or reduce the spread of infection? What's the best way to reduce the spread of infection? Everybody would go, wash your hands. You were taught that in your intro to nursing class. But could they have written a more difficult way to ask this question? Could it have been any harder than this to say what's most important and wash your hands? So what I'm telling you is you have got to practice, and it's not always going to say best. This says most effective. You've got to know how to read questions. You've got to know how to strategize through answering questions. You've got to pay attention. This is work, y'all. This is work. This is your job right now. This is your job to pass this. You've got to pay attention to this stuff. And you've got to practice these strategies. You've got to practice them because you're not going to do them on the NCLEX if you're not practicing them in your practice questions. All right, let's do one more. This is why I said, I don't know if you heard me say this, I'll talk about it a little bit later, but on a good day when I'm actually paying attention to the questions, I do a lot of data bank questions. On a good day, I get a 70%. On a good day. So what I'm saying is you should not be expecting to get an 80, 90, or 100%. You shouldn't be expecting to do that. You may get lucky one day. Like I get lucky once in a while, every once in a while, I get really lucky and I get 100% because I just happened to get all questions I knew, was able to figure them out. But that's just luck. That's not at my expectation. My expectation is to get maybe around a 70%. And that's if I'm really paying attention because these are work. These questions are not like, oh yeah, I just know the answer, bam, C. That's not what these questions are. These questions are problem solving, clinical reasoning. That's how they write them. You're supposed to be thinking while you take it. They do not expect you to read the question and immediately know the answer. That's not the expectation. They expect you to think. Okay, last question. A pregnant client in the first trimester tells the nurse that she was recently exposed to the Zika virus. Ooh, I don't know anything about the Zika virus while traveling in Southeast Asia. Which action by the nurse is most important? Most important means best. What's most important? Best to do. So I recognize this as a question where I go, well, they're asking what's best to do. So I'm going to have to compare one thing to the next. Let's see if I can rule anything out. Arrange for testing for Zika virus. No, they got to do that. Discuss need for multiple fetal ultrasounds during pregnancy. It seems like that's a good thing to do. Describe potential impact of Zika infection on fetal development. That's important. Assess for symptoms such as rash, joint pain, conjunctivitis, and fever. That seems important too. I can't just, they're all important. I can't just cross any of them out. So I'm going to have to take two at a time. Now, what is the question? She's in her first trimester and she was exposed to Zika virus. So for someone who's in their first trimester exposed to Zika virus, what's most important? All right. So I'm going to arrange for testing to see if she has Zika, but I'm never going to discuss the need for fetal ultrasounds. Or I'm going to discuss the need for fetal ultrasounds, but never test her to see if she has Zika virus. Oh, well, I have to test her. Don't we have to test her? I have to test her. All right, I'm going to cross that one off. Arrange for testing to see if she has the infection, but never describe the potential impact of the infection on fetal development. Or I'm going to describe the potential impact of the infection on fetal development, but I'm never going to actually test her to see if she has the infection. Well, that seems ridiculous. I got to test her. Or I'm going to arrange for testing, see if she has Zika infection, but I'm never going to assess her for the symptoms of Zika. Or I'm going to assess her for the symptoms of Zika, but never actually test her to see if she has it. I mean, I have to test her, don't I? Don't I have to test her? I have to. I have to do this. I have to do that. Now, what is the fundamental principle that they're testing here? Do you know you got to test for the infection before you tell them they have the infection? You got to test for it, y'all. That's pretty fundamental. I think we learned that back in our intro to nursing class, right? Maybe we learned that when we were in 4th grade. I don't know. First time you got sick, your mom or dad said, hey, we got to take you in to see what's going on. You got to see what's going on. Like, let's test you. First time you had a sore throat, we're going to test you for strep throat. Let's see if you actually have it. I think I do. My throat really hurts. Well, we got to test you to see if you do or not. Okay, we learned that in 4th grade. All right, now it didn't say best in the question, said most important, and you didn't have to know anything about Zika virus to get it right. It really was not a question about Zika virus. These kind of best questions like this, these fundamental questions where they're testing best, usually it doesn't have anything to do with the underlying disease. It's some fundamental principle that they're testing to see if you know it, some basic fundamental principle. Okay, let me do one more. I'm going to write out the question, okay, and then we'll answer it together. You're taking care of a frightened client. What is your best nursing action? Move them closer to the nurse's station. Give them a roommate. Spend extra time with them. Or answer their call light. Now, I don't know about you, but I'm not prepared to cross off any of these answers because they all seem like good things to do for a frightened client. So I'm going to have to compare 2 at a time. Don't think you're going to just stare at it and it's going to jump out at you because it's not. Okay. All right. Frightened client, what's best to do? Move them closer to the nurse's station. I'm going to move them closer to the nurse's station, but they're not going to have a roommate. So they're going to be in a private room near the nurse's station. Or they're going to be at the end of the hall, but they're going to have a roommate. So what do I like better? Well, I hope you like closer to the nurse's station because we never put the burden of a client's care on a roommate, right? You want the burden of that client's care to be on the nurses, not the roommate. So if we put them at the end of the hall with a roommate, we're kind of asking that roommate to take care of their frightened feelings, and that's not appropriate. So I'm moving them closer to the nurse's station. That's pretty straightforward to me. All right, I'm going to move them closer to the nurse's station, but I'm never going to spend extra time with them. Or I'll spend extra time with them, but they're going to be in a room at the end of the hall. Well, I hope you like move them closer to the nurse's station because being close to the nurse's station allows people to be there for them, hear them. They can hear the talking out there. They can call out if they need to. Whereas if we put them at the end of the hall, sometimes people at the end of the hall, you know, they're pretty isolated down there. I don't know if you've ever paid attention to how isolated some rooms are. So I'd rather move them closer to the nurse's station. To me, that's just better. All right, I'm going to move them closer to the nurse's station, but I'm never going to answer their call light. Or I'm always going to answer their call light, but they're going to be a room at the end of the hall. So that means I'm going to answer their call light even if they put their call light on every 4 minutes. I'm always going to answer their call light. Do you really want to tell the National Council of State Boards of Nursing that you're never going to answer somebody's call light? Do you want to say that? Because I don't want to tell them that. Because I know one of the most fundamental principles is you always have to answer people's call light, no matter how many times they put it on. So I have to pick answer their call light. And if I had just been looking at these answers and kind of just picking the one I liked best, I would not have picked that one. I wouldn't have, it really wouldn't have even been in my top 2. But when I do it this way, and I think, which one do I have to do? Not just for a frightened client, but not just for a frightened client, for everybody, then I have to pick 4. And do you see how this is a fundamental principle that it's testing? If I said, do you have to answer people's call light, or are you ever allowed to not answer? You go, of course I can't not answer. At least I'm not going to tell the National Council I'm not going to answer their call light. Of course I have to answer it. And we all know that. But it's not obvious with this question. All right. I'm going to talk about something in just a minute. 145 questions. 145 means 145 questions. Karen De Silva made a comment about a question I just did. She said, drinking water helps the flushing out of bacteria. And that's true, but that's not what the answer said. So let me go back to this answer, because that's not what the answer said. It didn't say drinking water. It didn't say encourage them to drink more water. It said assess their fluid intake. It did not say encourage them to drink more water. If it said encourage them to drink more water, or if it said encourage them to take in 2,000 mils a day, I would have said, oh, I like that answer, but that's not what it said. It said assess their intake. It didn't say encourage them to drink more water. So Karen, it makes a difference what the words say. That's why when you ask me, like not you, but when any of you ask me kind of this vague question, well, what do you think about this? I'm like, give it to me in a question, because the words matter, y'all. And if you've watched that video where I interview Mark, here's what he says, and this is so true. He says the only reason the right answer is the right answer is because of the other answers. The right answer is the right answer because of the other answers.